When it comes to the cardiovascular system, we often inappropriately think of the heart as the one and singular pump system to get blood all the way around. And that's from the heart to the capillaries, these things in gray here, and then all the way back from that system, through the veins and then back into the heart and lungs. But it's actually a ridiculous idea, because if the heart were that powerful, the arteries would actually blow off and it would be essentially self-destroying. And the arteries, of course, are the bigger tubes in red here that pump as well. They have a good muscular sheath around them, and a good fibrous sheath, in fact, that through contraction and recoil assists the heart in moving fluid. But the reality is, once we actually get to the capillary level, once we get to that gray part here, the energy of the heart is expended. There is like zero flow, negative zero. That's not a real number. There's no power behind it. So something else has to draw it back. So once we've gone from the oxygenated blood and we've dumped that O2 out into the tissue, and we pick up our CO2, our waste products, among other things, of course, we want to send that back through our venous system, which of course is quite extensive and goes, hey, all the way to the legs, bam. And we want to take some of that back as well through our lymphatic system, bam, in green, which is cool because it's got vessels and nodes and stuff. We need to get it all back. It's got to return to that heart. It's got to make a full circuit if we want to get rid of those waste products. If we want to recharge the oxygen, it all has to come around every single time, and a lot of it all day long, every part of your day, in fact. So this loop needs some assistance. Making sure this actually happens is incredibly important. And there's both internal factors and external factors to both of these. So just to really simplify, both, and a lot of people don't know this, both veins in blue and the lymphatics in green both have muscles in their vessel walls. And what that means is there are usually longitudinally running muscles that run along the length of the tubes, and they can contract, and they're not huge, but they can contract, and they encourage a change in shape. They'll draw the, let's say, vein or the lymphatic this way. And this is very assistive because it changes the shape of the vessel and pushes the two surfaces together. When we talk about valves in a second, it'll make a little bit more sense. Now, in the case of the lymphatics, actually, they have a bunch of muscles around their nodes too. And I'm saying this more for clarity than anything. Muscles before and after, and they control the speed and the flow of fluid into this area. And that's important. But the more important thing, the more interesting design, is in the valve system of these things. So just going to the side, and this will work for both veins and lymphatics. We have a tube, we call the vein here, we'll just say that's a vein, and it will have a few different valves throughout it, a few of these looking things if we did a cross section. And what they do is they ensure that the blood flow is always in the right direction, regardless of the pressure placed on it. So if the fluid is going this way, the valves flap open. They want to go like this, and they open up and they allow that fluid to pass through. But should we create back pressure, should we knock out 1 second, and we end up pushing the fluid in the opposite direction, what will happen is essentially the opposite. The fluid starts to go backwards. The valves press shut because the volume of fluid gets caught up in it, and it stops that blood from flowing backwards. Of course, it can be overpowered. It's not a perfect system. And when it does, it can be a little bit dangerous. We might get enlarged veins, and these can potentially, though rarely, but potentially form blood clots if you give them long enough. But basically what this does, provided it's working right, it allows the veins to take almost any direction of pressure. It doesn't really matter which direction you push it from. It takes that pressure that's placed on it, even if it's perpendicular, sideways coming in, even if it's only sort of in line with the direction of the vein. It can take all that and ensure that that fluid, that venous fluid, is always headed back towards the heart, ensuring the correct direction. And this is really neat. It's a great design, and it's relatively low cost. The only way to really reverse that entirely would be to actually go in the exact opposite way of pressure in that direction. But that's hard, and it's in fact has to be done, intentionally, which is kind of a bad idea. It's a silly idea. Don't do that. Why would you do that? Anyways, this means that anything outside and moving can actually help a vein or a lymphatic vessel in moving fluid along. And what those things are, what those outside things are, we've got the internal muscular system, we've got the valves in the veins and lymphatics. But the external system is the muscles and the fascial tube, the fascial connective tubes. Muscles are fascia, I know that, but nobody else knows that unless you're heavily involved in this. So I'm saying muscles and fascias are kind of sort of not really different things. Anyways, let's get less technical for a second. Understand that a completely normal configuration is that we'll have a muscle. Let's say these hamstrings here. We'll have a muscle, and there'll be an artery between that and the bone. So the muscle, artery, bone. Pairing with that, very typically, is a vein running the same course, though opposite directions of flow. We'll often, as well, have a nerve that wraps around, and there'll be a few different things. This kind of looks like a hot dog now. And then we'll probably also have our lymphatic vessels and nodes. I'm not going to draw it all, just to keep it nice and simple. So all that runs together. We call the neurovascular lymphatic bundle. Whatever you want to call it is fine, but just it's a tube of fluids, and even the nerves, in a way, are fluid tubes. So when this is the case, now we're going to focus mainly on the veins and lymphatics, but when this is the case, if the muscle contracts and there's bone there, the muscle will expand. It will get a little bit bigger. It will get noticeably bigger. The appendage, of course, will move along with it. You'll get knee flexion, maybe you'll get a bit of hip flexion, but essentially this muscle in this location expands a little bit outward and a little bit inward, and it puts pressure on whatever's there. And if it just so happens to be that there is a vein and a lymphatic in that region, a lymphatic structure, nodes and vessels, they get pressurized, they get pushed upon. Even if it's not in the exact right direction, that's great, because guess what? Again, the valves ensure the proper movement of fluid, and the muscles help coordinate it too. So all of this is working together. This is a great thing. So these changing in contractions can actually assist. Now as well, when we get rid of that contraction, when we stop contracting, we relax. We actually allow the next wave of fluid in. So the muscle on is good, helps pressurize things and move venous fluid up, again back towards the heart. But at the same time, when that contraction is done, the next lowest segment moves upwards and into the next segment to be contracted. So the on-off motion of, for instance, flexion and extension of that lower limb is constantly moving fluid. We do it for locomotion, of course. We do it for getting around. But the backwards, forwards motion of the legs, the contraction of the hamstrings, the contraction of the quadriceps, is constantly putting pressure on and off the venous and lymphatic structures, on and off all the time. Some of this muscle contraction happens actually involuntarily. There's a little bit of tone in every single muscle, and it's constantly going up and down a little bit to a minor extent. And this moves venous and lymphatic fluid through muscular contraction. And this is really important because it's happening all over the body, not just the legs, of course, but all over in the arms and in the neck, and just about everywhere. And so this is a huge assistance to the cardiovascular system. It's not the main pump of the cardiovascular system. By all means, that's the heart and the arteries, but it's a huge benefit. It's a huge assist to that system, to ensuring blood flow returns. And we actually need this muscle tone. As we increase, as we go up and up in effort, it makes a lot of sense because we generate a lot more waste products. So of course we would have more venous return with muscular action. It's basic, really. You really don't have to explain that to too many people to make sense of it. That's just how it works. You use it more, you should pump it more. But at the same time, it is a base level of motion that we need. Now, in addition to that, it's not just about It's not just about the muscle contraction. That would be too easy, in fact. But we have fascial tubes. I'm going to keep that real simple. Sheaths or coverings or surroundings. And what this does, if you're looking at it from, let's say a cross section, if you're looking at it, if you cut it all up, you'll have typically the bone in the middle, and then you'll have several compartments of muscle. Let's say something like that, inside, outside, left, right, all that stuff. Muscle. And then within that, let's say, I'll just chunk something out right here. Within that, you'll have the tube system covered in the same stuff, in that same fascia all the way around. For the nerve, artery, vein, and lymphatic, all that runs together. All that is tied in together. It even ties into the periosteum of the bone, the outer covering of the bone. So it really is one thing altogether. Seeing it as separate is actually kind of a ridiculous idea when you really look at the interweaving of these structures. And so it's not just about the muscles contracting that assists the fluid in returning to the heart. It's not just about active, neurologically controlled things. But when we torque and when we shift through this tube, as we change the tensions in it, we actually also change the tension or the pressure that's being put on the veins and lymphatics. So if we're going through these motions, if we're going into, say, knee extension, hip extension as we get from our quadriceps here, understand that we've got fixed points within that tissue. We've got stuff that's more proximal, and therefore it's a little more stuck to the pelvis, let's say. And as we shift that, we put strain directly, not strain, but at least pull. We got pull and tension put on that fascial tube, and the contents inside are also pulled on. In the same way that muscular pressure exerted on that venous structure, on that lymphatic structure, can encourage fluid to flow in the right direction, really regardless of the angle. And again, unless it's in the exact opposite angle, which is very difficult to do. Any pressure, any change in that pressure will put more emphasis on blood flow. In a lot of ways, when we're looking at this, if we have, let's just say, a simple fascial structure, so first we'll get, a vein right in the middle. And if we have just a simple fascial covering in that area, as we pull down on it, as we pull that thing downward, what we end up doing is, because the two sides are attached together, because they're fixed, both from the top and the less mobile trunk, let's say, and by comparison, less mobile leg, true leg in this case, the fascial structures actually pull a little bit tighter. It's as if they're doing this now, and it increases the pressure in that center point. And it just so happens we almost always have our neurovascular lymphatic bundles tied up in those central points between a bone and a muscle encased within the same fascial sheath. So regardless of what you're doing, whether it's active muscle contraction or just changing in tension in and around the area of these fluid tubes, of the veins and the lymphatics, ultimately we end up with a good amount of fluid being pumped through the opposite end of the active, contractile heart and artery side of the cardiovascular system. This is all about venous and lymphatic return. These are heavily assisted by the muscular and fascial systems, the systems we often take for granted and we don't see as really contributing to anything but locomotion. And this is, not the case. So this means that exercise therapy and manual therapies that help with changing the tone of the muscles, making sure it's properly coordinated, not too excessive so we don't get a constant pressure on the pump, but also not too lax so we can alternate between high and low and keep that pump going, but also that work on mobility. Again, exercise therapies, manual therapies like fascial stretch therapy and physiotherapy, chiropractic, osteopathy, all these things, they do a pretty good job of making sure the body is in the best possible state to assist with fluid return and the cardiovascular system in the body. Well, I hope that made sense. I had a lot of fun doing that. Colors look nice. Simple Ends Anatomy, Elge.